Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. Our sincere apologies for the delay. There was a technical issue that unfortunately took a while to figure out. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before today's update, I would like to offer my condolences to the friends and family of Dr. Reynolds, a physician who died following an attack while working at a Red Deer Medical Clinic earlier this week. We are all shaken by this tragic event. I imagine that though this was an isolated incident, it leaves a mark on all healthcare professionals as we wonder about the safety of our own workplaces and the personalized patient care that is the bedrock of our profession. It is in times of tragedy that we most need to feel connected to those around us. COVID-19 restrictions mean we aren't able to do that in the ways that we have been used to. Despite the need to make adjustments for our new normal, I encourage all who are experiencing grief, whether due to this situation or other losses, to find ways to reach out to others and bear the burden of grief together. Before turning to today's numbers, I also want to mention an update that we are making to the retrospective hospitalization data that is available online. When the website is updated today, there will be a decline in the hospitalization numbers for May and June. We have committed to always being transparent, so let me explain why. When the outbreak occurred at the Misericordia Community Hospital last month, an error in the system code used for our online statistics meant that patients who caught COVID in the hospital were being retrospectively counted in our hospitalized case data. Most of these patients were first admitted weeks or even months before the outbreak, yet they were counted as hospitalized with COVID from the day that they first entered the Misericordia, not the day they were diagnosed with the virus. This led to an increase in our retrospective totals, which I know some Albertans have been wondering about. Thanks to the hard work of our surveillance team, this issue has now been fixed. Obviously, any decrease in hospitalizations is a good thing. This error had little impact on our current hospitalization counts that we have been reporting daily and did not affect any of the COVID-19 policy decisions that we have made. Turning to today's numbers, currently, 50 people are in hospital, including 13 in intensive care. We identified 121 new cases in the last 24 hours. There are now 1,040 active cases in the province. This is a reminder that COVID-19 continues to be with us, and we cannot turn our backs on this virus. Tragically, I am reporting one additional death today at the Good Samaritan Southgate Care Centre. This death occurred yesterday and was reported earlier on their website. My heartfelt condolences go out to everyone who has lost a loved one to COVID-19 or any other cause during this pandemic. The lab has completed more than 8,000 tests in the last 24 hours and more than 785,000 tests overall. I saved the testing data for last because that will be the focus for my update today. Testing is a powerful tool that helps us limit the spread of COVID-19 and protect people from infection. 1 in 7 Albertans have now been tested at least once, and that is a significant accomplishment for our province. Our labs have come a long way since COVID-19 was first diagnosed in Alberta. We have consistently had the most open testing approach in Canada. Our labs have conducted more than 316,000 asymptomatic surveillance tests. These are tests on people who had no symptoms and were not part of an outbreak or a close contact of someone who had COVID-19. Of these 316,000 tests completed so far, just 0.1% have come back positive, meaning that 99.9% of asymptomatic tests on those who had no known exposure have come back negative. This is encouraging. This testing shows that broad asymptomatic testing is not primarily useful in identifying a significant number of new cases, However, it can help us track the spread of the virus in Alberta, which aids our public health response. We are now about 3 weeks away from schools reopening. I know that many parents and school staff have questions about whether or not they should be tested. Today, I want to provide some advice. In addition to the most critical testing of anyone with symptoms, I am recommending that all teachers and school-based staff, even without symptoms, should get tested once before school begins in September and regularly throughout the year. This is entirely voluntary. However, asymptomatic testing of staff in school settings will help us with a baseline understanding for school reentry, and ultimately help us even more closely monitor the virus in the coming year. My recommendation today comes with a caveat. There are about 90,000 school staff and teachers across Alberta. Our testing capacity has expanded greatly, but no province in Canada can collect and process that many tests all at once. I am asking teachers and educational staff to arrange testing proactively. Do not wait until the day before you are set to return to school. More information will be shared via your superintendents in the coming days. I am also asking other Albertans who feel completely well and who have no known exposure to COVID-19 to delay their testing until after September 1st. This will help ensure the system has capacity so that all school staff can access this voluntary testing before the school year starts. To be clear, if you have any symptoms, no matter your occupation, you can and should still get tested. If you have no symptoms, but you were a close contact of a case of COVID or part of an outbreak, you can and should still get tested. If you feel completely well and have not been in contact with a confirmed case, we are just asking you to consider waiting until after September 1st to book a test. Parents can continue to access testing for their children whenever they want. However, I am only recommending that children be tested if they have symptoms or pre-existing medical conditions that have symptoms similar to COVID-19. This is because in students, our priority is to make testing available to all those with ongoing mild symptoms that may mimic COVID-19, such as allergies. Parents should book all such tests through Alberta Health Services. Do not go to your local participating pharmacy, as these tests are for those who have no symptoms and no exposure. Having a test done before school to ensure these unchanged symptoms are not a sign of COVID-19 helps as a baseline for parents to monitor from as their children go back to school. In addition, all parents should monitor children for new symptoms. This is part of the daily routine that all of us parents must start getting used to. If children experience new symptoms at any time, then testing is the right choice and available through AHS. I know that testing wait times have been a concern, and we are expanding public testing capacity to help meet this demand. I will have more to say about that in the weeks ahead. Now, it's important to remember that there is no magic bullet for COVID-19. Testing, while a powerful tool, is only one layer that we are using to help limit the spread of COVID-19 in schools. Even more important are the other measures in place, such as daily symptom screening, enhanced sanitizing, washing hands, use of masks, and adjusting class routines and school approaches to minimize spread. We are creating public health protocols to help schools and parents know exactly what will happen if a student or staff tests positive. I hope to be able to share these protocols very soon. I know that this is a difficult time for many of us. There is still no risk-free approach to living with COVID-19. It is natural that many feel anxious about the coming school year. I believe that when everyone in the school community does their part, we can limit the number of cases in schools and keep children, staff, and teachers as safe as possible. Jurisdictions around the world are trying to determine the most effective way to reopen schools. We will continue to watch their experiences closely and continue to act on the best evidence available both from other jurisdictions and our own local evidence. This is part of living in the new normal of COVID-19. We must be agile, adaptive, and guided by the evidence as it emerges. As I've said before, COVID-19 is not going away anytime soon. We all need to embrace our new normal, and that includes self-care. I will be taking a few days off to spend time with my family. We will continue to update the website every weekday with new numbers, and my next availability will be next Tuesday afternoon. I want to end today on a positive note. I understand that living in uncertainty can be disheartening and difficult, and the news lately has been hard to listen to. It's important in times like these to remember the many good things that are happening, the ways that Albertans are supporting each other and showing their care. The Alberta Cares hashtag has highlighted some stories lately that can remind us of this. I want to recognize Eva Ketchmark, a 12-year-old who donated her 4-H steer to the Lethbridge Soup Kitchen, providing meat that will last for 6 months. I want to recognize the Rock Point Church Volunteer Youth Group, who took care of outdoor maintenance and gardening at the Bethany Care Society in Cochrane, so its residents could enjoy the outdoor space during this pandemic. And I want to recognize the Sage Seniors Association, which distributed 200 personal protective equipment packages to seniors in Edmonton. These serve as important reminders that we are surrounded by people who care. We are part of something bigger than ourselves, and as always, we are all in this together. Thank you, and I'm happy to answer any questions you may have.
All right, our apologies again for the delay. Operator, could you put through the first question, please?
The first question comes from Rafi Buchanan of CBC. Your line is open.
Good afternoon, Dr. Hinshaw. I was wondering with regard to recommending teachers and staff to get tested, wouldn't that be simpler if it was possible to bring these tests to the schools where these teachers are working? And also, how much of a strain is, say, testing NHL players every day, putting on the testing system, while we're also asking teachers to get tested?
Thank you for those questions. With respect to bringing tests to schools, the current recommendation is that teachers be tested before school starts. Schools at the moment aren't open, and so we are recommending that teachers book appointments either through Alberta Health Services or local pharmacies through that already available testing system. We are looking at multiple options for the fall and determining what would be the ways to enhance access to testing for those groups of people where it's most needed. And so there may be other options in the fall, but for right now, again, schools aren't currently open, and we are using our current system to enable that testing for teachers. With respect to the NHL, all of the NHL testing, and that includes the sample collection as well as the lab test component, is being done privately through private labs. And so that is not competing with our public system for any of the resources needed to collect samples, to run the lab tests, or any other component of that public system. So again, they're completely separate, and that NHL testing is all privately paid for.
Operator, can you put through the next question, please? Operator, are you there?
Sorry about that. Next is Jason Herring with the Calgary Herald. Go ahead, Jason.
Thanks so much. Dr. Hinshaw, I'm wondering, mandated masking bylaws in Edmonton and Calgary both took effect on August 1st. When will we know if those bylaws have successfully helped lower the rate of spread of COVID-19 in those cities? And as well, I'm wondering if you can comment on the diverging paths that these cities seem to be taking, with 95 new cases in the Edmonton zone today and only 14 in the Calgary zone.
So with respect to the mask bylaw and the impact on spread, as you know, cases, once they're exposed, it can take up to 14 days for them to develop symptoms, and depending on then when they access testing, there can be a bit of a delay. So I would expect that any impact on the numbers would take a few weeks before we'd be able to see that impact. It's also really important to remember that the mask bylaw is going to help the most in public places, in places where people are, outside, in areas where they're not able to maintain distance, most of those indoor spaces where this applies. The mask bylaw will not have any impact on household spread or spread perhaps within different workplaces, depending on, whether or not that workplace is impacted by the mask bylaw. We have seen in Edmonton, many of our recent cases have been spread within households. So people who are living together and one person gets COVID and it passes to others within that family. And of course, that would not be impacted at all by the mask bylaw. So what we'll be looking for is really looking at where people potentially were exposed to be able to determine whether or not there's an impact. Again, you can't look at the overall case numbers because if most of them are household spread, then we wouldn't anticipate the mask bylaw would have prevented that. The question about the two different cities, we are looking very closely at the Edmonton data. As you note, there have been an increasing number of cases in Edmonton. What we know right now from the most recent cases is they do continue to be in a younger age group. So in Northeast Edmonton, 77% of cases are under the age of 40. We also see our median age in all of Edmonton as 30 years old. So again, looking at that younger age group, that continues to be a trend. It does take us some time once we get the lab reports in, which is what we report on. It can take several days for public health to be able to make those phone calls, identify where people potentially were exposed, follow up with close contacts, and identify any patterns or themes with respect to the transmission of infection. And so I think we'll be able to see more detail of where those patterns of concern might be in the days ahead. But right now, what we know mostly is the demographics in those locations, as I mentioned.
Operator, can you put through the next question, please?
Next is Kevin Nimick with CTV Calgary. Go ahead, Kevin.
Hi, Dr. Hinshaw. On Monday, you said Albertans should consider narrowing their cohorts. I'm going to give you a scenario. Can you tell me how to limit that cohort? So let's say I have a spouse and we both go into an office every day. 2 separate offices. I also have 2 children, one in elementary school and one in junior high. One plays hockey and the other plays basketball. We see their grandparents once a week. How can I limit that cohort? Are you suggesting parents should pull their kids out of sports, for example?
I think every family needs to consider what their risks are. So in the example that you've given, you have 2 different office settings, and depending on the work that you do, ideally in a work setting or office setting, there would be measures in place to limit the possibility that COVID could spread in that office environment. So the people that we work with in office environments, as long as we're staying consistently 2 meters apart, wearing masks when we can't, and ensuring we're not going to work when we're sick, all of those other measures, we wouldn't necessarily consider people within a workplace to be a part of a cohort, again, depending on the type of work. So ideally, with this particular example, the 2 parents in this example wouldn't necessarily be part of those 2 separate office cohorts because there should be measures in place to prevent transmission in those settings. Then you have the 2 children you've mentioned. Each of them would have a different school cohort, and you've mentioned each of them play one different sport. So I think in that particular example, it wouldn't necessarily be stopping playing the sport, but perhaps for the first several weeks of school, the first month of school reentry, you may want to reconsider the weekly visit to the grandparents, or perhaps do that visit in a different way, particularly because the children each of them have the 2 different cohorts, and going back to school, there will be additional potential interactions with kids they haven't previously been interacting with. So that would be, again, my answer for you. Other families, may be engaged, for example, in we have dramatic performance cohorts. There are sports team cohorts. Some sports teams may be ending at the end of summer. And so again, maybe it's a decision about whether and when to restart a sports cohort when a child is going back to school. But again, these are very individual decisions, and particularly if there is somebody who's at high risk of severe outcomes from COVID, those would be the cases where I would most recommend trying to limit your cohort as the children go back to school.
Operator, could you put through the next question, please?
Next is Bridget Moore with Post Media. Go ahead, Bridget.
Good afternoon, Dr. Hinshaw. We recently just talked about the mask bylaws that have taken place in Edmonton and Calgary, and there are several other communities following suit. In some communities where it hasn't become a bylaw, some of the stores themselves are taking that on. In Edmonton, they've had the mask exemption card. What would you recommend to someone who, for emotional, mental, or health reasons, cannot wear a mask, but there's not a bylaw or a way to get an exemption card? How can they go about still going to stores, and what would you recommend to them in that situation on how they deal with those situations?
I know that in some municipalities, as you mentioned, exemption processes have been worked out. Exemption processes are currently being worked out with respect to the requirements for school. We have listed the categories of exemptions, including health reasons, which could include mental health or physical chronic conditions. And so those are some things that we'll be working on processes with the Education Ministry. And so I guess what I would say is it does depend to some extent on who is setting the rules. The provincial mask wearing requirement in schools, we are going to be working closely with education to make sure that it's really clear what the exemptions are and how people can pursue them. Again, whether there's a formal request process or if it's something that is more of a self-report, those are things that are currently being worked out. We know that parents of school children, staff and teachers want answers to that and as quickly as possible so they can plan for going back to school. So we are working on that as a priority. But again, that's the process I can speak in most detail to, is the processes that are happening at a provincial level. With respect to questions about exemptions at a local municipal level or even at a store level, I think that would be something where people who aren't able to wear masks can look at their local municipality. I believe that many of them do have exemptions, and then get detail around how they would get that exemption. And again, I would really encourage people, as we're all going about our daily lives, to be supportive and encouraging of each other, knowing that there are some people who cannot wear masks, that as many of us who can is really important so that we get the most possible protection as a collective. But my advice is always to be supportive of others rather than shaming or pointing and calling people out. So in general, that's what I would say. I sympathize with those who can't wear masks, but again, the role that I have is mostly in creating a clear exemption process at a provincial level, and they would have to work with those other levels that have set the rules for exemption processes at those different levels.
Operator, could you put through the next question, please?
Next is Tom Vernon with Global Edmonton. Go ahead, Tom.
Hi, Dr. Hinshaw. Thanks for taking my question. British Columbia yesterday announced that they will delay bringing students back into classrooms in order to give teachers and support staff and administration more time to get an idea of what classrooms will look like and get prepared. Are you considering the same move here in Alberta? And is this something that you're looking at?
My understanding of that decision that was announced by the Ministry of Education in BC is that it was an education ministry decision. In Alberta, the context and process of deciding school reentry is something that the Ministry of Education sets, so that probably would be a question they would be better positioned to answer as it's more related to, again, that process of school preparation.
Operator, could you put through the next question, please?
Next is Andrea Hunkar with BBC. Go ahead, Andrea.
Thank you. Hi, Dr. Hinshaw. The Canadian Prison Law Association wrote to you in April raising concerns of non-compliance of COVID protocols in Edmonton remand and the risk to inmates, staff, and the public. I wanted to ask you why you haven't replied to their letters or emails, and also if you could please clarify whether the Chief Medical Officer of Health has jurisdiction in Alberta jails and detention centres.
I did receive the letter you reference, and when it came to my office, my team forwarded it on to Alberta Justice and Solicitor General to raise that issue. As you know, Alberta Justice and Solicitor General has jurisdiction over the provincial correctional facilities. The federal correctional facilities are, again, a federal jurisdiction. And so my office has met with representatives from those particular areas, from those ministries, to discuss some of the issues that were raised in the letter. I believe the most recent was last week. My team hasn't debriefed me yet on the outcomes of that meeting, but my role with respect to public health is certainly to look after the health of the individuals in the province, and that includes, again, providing recommendations to the jurisdictions. So in this case, it would be Alberta Justice and Solicitor General who oversee those particular settings. So we can get back to you with details about the outcome of that meeting last week, as I don't have those details with me right now.
Operator, could you put through the next question, please?
Next is Brianna Karsten-Smith with Global. Go ahead, Brianna.
Hi, Dr. Hinshaw. Thanks for taking my question. I wanted to ask about the rise in active cases in Edmonton, and if you can get into a bit more of why we're seeing them. If they're sort of the age of 30 and within households, is it people going out and interacting with a lot of people and then coming home and passing it on, or just where are we seeing that? And also, we are seeing a record number of active cases in Edmonton. So are you looking at new restrictions? And if not, then when will you start to look at new restrictions for the Edmonton zone?
With respect to the patterns that we're seeing, we are seeing, as I mentioned, a lot of household transmission. Many of the newer cases, so for example, the cases that we're reporting today, are ones that we haven't been able to finish that public health investigation yet. So we don't, unfortunately, have as many details as we hope to gain as we complete those investigations. So with respect to those patterns, again, that's going to take us a bit of time to work through that typical process and to be able to identify if there are some particular outbreaks that are driving this, if there are, again, the household transmission, and if there are any patterns in more public places that seem to be driving this. The question about whether or not we're going to be imposing any additional restrictions in Edmonton, I think what we've seen over the past many months is that some locations can, go up in cases, come down a bit. We did see Calgary have quite a lot of active cases. They did come down, went back up, have come down again. And so ultimately the goal of my office is to work with local public health who have the best eye on the ground with respect to the patterns of cases they're seeing, and to work with the local municipality and make sure that if there are particular areas of concern that we're working collaboratively. And as I mentioned at this point, we haven't identified any one particular area of concern that seems to be driving this new case rise. If we do identify that, our first step would always be, as it has been for many months now, to work collaboratively and to make sure that we're looking at what are all the things that we can do to limit the spread. And if there were some additional measures that needed to be taken, they could be considered, but we're not at that point right now.
All right, we've got time for 2 more questions. Operator, could you put through the next one, please?
Next is Andrew Walker with 88.1 FM. Go ahead, Andrew.
Hi, Dr. Hinshaw. A few weeks ago, you announced the expansion of pharmacies offering COVID-19 testing, but locals in certain counties, especially Parkland County, are finding it hard to access one, especially those without a car. Will small towns expect to have at least one that provides testing? And how can they find out if their local pharmacy is in the works of offering tests? Thank you.
The Blue Cross, Alberta Blue Cross site has a list of all participating pharmacies, and there are more pharmacies being added regularly as pharmacies come online with this testing option. And unfortunately, that doesn't necessarily give you a list of the pharmacies that might be coming online in the next weeks to months. It just tells you those where testing is currently available. But we are working actively with pharmacies across the province to make sure that they are able to move into offering testing as soon as they have the appropriate setup. and if they wish to do so. This is a voluntary program, so pharmacists don't have to participate. They can choose to do so. What I would suggest, if people are really interested in a local pharmacy offering testing, they may want to make that suggestion to their local pharmacist so that the local pharmacies know what kind of interest there might be in that local area. But the way that they can know what is being offered is, again, to go to the Alberta Blue Cross website on a regular basis to see what those updates have been and where testing is currently being offered.
All right, operator, could you put through the final question, please?
The final question is Shannon Scott with CBC Calgary. Go ahead, Shannon.
Oh, hi, Dr. Hinshaw. I have a question about class sizes. We're hearing concerns from lots of parents and some teachers about class sizes and the ability to physically distance once everyone heads back to school in September. I'm wondering what it is that you recommended to the Department of Education when it comes to class sizes. I'm also wondering if your recommendation included a limit on class sizes, and if it didn't, why not?
What we know from looking at experiences of other countries around the world and with respect to their school reopening processes and plans is that there's no one right way that's going to work in all settings for reopening schools. When my team and I were working with the Department of Education to make recommendations around school reopening, we were looking at the overall health of kids and the things that kids need to be healthy, including limiting the possibility that COVID would spread in a school, but also the benefits that kids get when they're able to be in school. We did not recommend a maximum cap or maximum class size, but rather made recommendations around maximizing physical distancing wherever possible and using additional measures such as cohorting students, the regular daily symptom checks and screening, the enhanced hand washing, and more recently masking when students are outside their cohorts, outside their classrooms, in the hallways, or undertaking classroom activities where they're not sitting still and maximally distanced. And so, again, the recommendations were based on looking at other jurisdictions that have been able to successfully open schools with varying levels of class sizes, and also the really important piece that is the key in almost every example is that when we're able to keep our community transmission at a low level, that is one of the most important things for a successful school reentry. And so it's really that community transmission at a low level that's going to help facilitate our school reentry being successful. And so I will repeat my plea from my past several weeks of updates that the more that we can do collectively to reduce our rates, the better positioned we'll be for successful school reentry, on top of all of the other measures that we've talked about with respect to symptom screening, regular cleaning, cohorting, and distancing to the extent possible.
All right, thank you all for joining us. Dr. Hinshaw will provide another update on Tuesday. Additional data will be posted online every weekday.